90 minutes ago now, the governor and state health director, they are putting in place an emergency order that will impact anyone who goes into a hospital across our state. Our Jason Berry joined us now live to explain how hospitals, Jason, will now be making life and death decisions.
Yeah, this is something nobody wanted, but it happened. Arizona hospitals are now working under a crisis standard of care, which means anyone who goes into a hospital will be assessed and they will be given a score. And that will determine whether or not they get priority treatment. The COVID-19 crisis in Arizona is getting worse, with the number of patients skyrocketing across the state. And that's putting a serious strain on hospitals and urgent care facilities, running out of beds and medical supplies to treat coronavirus patients.
Allow for the critically sick to get their treatment.
Anne Marie Almaden is president of Arizona's Hospital and Healthcare Association.
As they are expanding their capacity, they're creating ICUs where there normally aren't ICU rooms to make sure that we can have that capacity to take care of patients as they come to the hospital.
Today's State Health Director, Dr. Cara Christ, announced with the governor the activation of an emergency health plan that will implement a crisis standard of care at medical centers across the state. It's basically an emergency declaration that will change the way patients are treated based on dwindling medical supplies, hospital staff, and ICU beds.
A lot of states actually have activated their crisis standards of care plan, so it gives the hospitals a framework that allows them to determine if they do get short of resources, how they can allocate those. The other thing that it does, though, is it also gives their healthcare workers some liability protection as well. So not all of our hospitals actually meet crisis standards of care just yet. So it was a proactive step by our hospitals.
It's come to that now.
Will Humble is president of Arizona's Public Health Association. Humble told us a crisis standard of care gives healthcare providers a guideline on how to treat every patient that comes in the hospital. Each patient will be given a score based on their current health condition and likelihood of survival. Other factors like age and prognosis are also considered. Patients with the lowest scores get priority for treatment. Humble says it's similar to how doctors assess and treat our troops on the battlefield in times of war, often deciding who lives and who dies.
If you're a wartime physician or, working in combat situations, it's a normal thing that you expect to have to deal with that. But when you're in civilian life and working as a physician or a healthcare provider, I don't think anybody really expected to be able to have to be in a position to make those kinds of really difficult decisions.
It's very possible that healthcare providers will have to decide whether or not a 25-year-old single mom gets an ICU bed or it goes to a 75-year-old man with a history of heart and lung problems. We're talking life and death decisions about who gets treated right away and who doesn't. And that goes for everyone in the hospital, not just COVID-19 patients. In Phoenix, Jason Berry for Arizona's Family.
All right.